Hello there, the Nerd Medic here. In this video, we will talk about a pattern-based approach to identify the types of irregular breathing patterns that we commonly face in wards as well as in exams. Now first, we will look into the normal breathing pattern. So over here, you can see this is the normal breathing pattern in frequency as well as in depth. Now, if the depth increases and there is a fast breathing, that is increased frequency and increased depth, this type of breathing is known as Kussmaul's breathing. From the K in Kussmaul, you can remember it is seen in case of ketoacidosis, like diabetic ketoacidosis, starvation ketoacidosis, etc. The name Kussmaul itself can help you to remember the causes of high anion gap metabolic acidosis. The mnemonic video is available on our channel. Please check the pinned comment. Next we come to this type of a breathing pattern where there is a crescendo, then decrescendo type of breathing, and then there is a complete cessation of breathing, and then again crescendo, decrescendo pattern. So crescendo should remind you it is a Cheyne-Stokes breathing. The C in crescendo, the C in Cheyne must remind you that this is due to cardiac causes. For example, congestive heart failure. Then we come to a breathing pattern where you have a phase of increased depth of breathing, that is hyperapnea. Then you have no breathing, that is apnea. And again a phase of increased depth of breathing and then no breathing. This is known as Biots breathing. The B in Biots should remind you that this is a brain problem, as in case of brainstem issues or meningitis. Now over here, this breathing pattern where you have shallow, a typical breathing pattern that you can see is known as apneustic breathing or apneusis. Apneusis starts with APN. This APN should remind you that it is associated with PAN, which rhymes with pons. So in pontine lesions, you will have apneustic breathing. Then you have ataxic breathing, a completely featureless, patternless irregularity. That is seen in case of medullary lesions. And finally, you have complete stoppage of breathing or arrest. I believe you don't need a mnemonic for that, right? So finally, these are the most commonly asked questions regarding irregular breathing pattern. Out of that, if you can only remember Kussmaul's, Cheyne-Stokes and Biots, you are good to go for your exams. If you enjoy videos of this type, press the like button and give us a hype. Press subscribe and ring the bell icon so that you never ever miss a video from my channel. Until then, bye bye. See you in the next one.